You just got an arm lift and you forgot all of the information that my office gave you about the recovery. Don't worry about it, we got you. I'm Joubin Gabbay, board-certified plastic surgeon in Beverly Hills. I'm the clinical chief of plastic surgery at Cedars-Sinai, and I want to help you understand the recovery process after an arm lift or brachioplasty. There's a lot to think about and a lot that we do to give you the best recovery possible, which will give you the best result possible. So let's start at the day of surgery. So given with pretty much every arm lift I do is that there is going to be a significant amount of liposuction done at the same time. Because of that, you can expect to be leaking out a lot of the numbing medicine we put in there as a part of the operation. So get ready for a mess, put some pads around wherever you sit, and you're gonna help keep things nice and protected. Now that's a really important thing because we allow the fluid that we put in to come out easily. Because by allowing it to get out, we minimize inflammation that occurs after your surgery, which will help you heal and recover faster. So one thing we really work on is to minimize that swelling in your arm. And because of that, literally from day one of your surgery, when you're resting in a chair, in your bed, you can expect to keep your arms elevated. So go ahead and put a couple of pillows under your arms next to your chair, next to your bed. That will help that blood and fluid flow out of your arm into either your lymph nodes, your heart, wherever, just out of here. During this recovery process, we're going to have you in a compression garment, which will help just kind of gently squeeze down the tissues here to help prevent you from swelling excessively. I think it's very important to keep that compression garment on for at least 2 months after surgery. Now, another thing that we will do is start you on special post-operative massages very shortly after surgery. We're talking with the first 1 or 2, 3 days after surgery, and those massages will help push out that inflammation and physically thin down the tissues underneath your skin to help both speed your recovery, reduce your pain, and give you a result that will be as tight and beautiful as possible. So in the first days after surgery, I do not want you laying in bed paralyzed, okay? I want you up, I want you moving around. Now to that end, we will give you pain medications that will help make things more comfortable. The good thing is that most patients will get off of the narcotic pain medications with only in a couple of days after surgery. There are a lot of reasons we want that. Pain medications can be so different. The narcotic ones can cause constipation. They can make you a little foggy in the head. They can have a lot of issues that our patients do not like. And honestly, I feel like they don't get to the root of the problem. I'm a fan of using non-narcotic pain medications as quickly as possible. And my office really specializes in helping you find that right medication regimen to keep you comfortable, active, and honestly, lucid. We don't want you in a fog after surgery. We want you there. We want you engaged in the process. So I'm going to see you within the days of your surgery. My team will be in touch with you immediately after surgery, and we are always available for any part of that recovery. After I see you, we start working on your recovery in every aspect possible. The thing that we are probably the most active in is working on your scar. Because let's face it, the scar of an arm lift is the thing that patients are most concerned about in pretty much every case. And that's because the scars have a history of having a bad reputation. That means from the moment we see you after surgery, we are doing all the things we need to do with all of the different scar healing modalities we have to customize our plan to your need and give you that best scar possible. More about that in the future. So during the first week after surgery, you're starting to move around. You're starting to learn what you can and cannot do. And my number one rule of recovery is going to guide you in that process. The rule is, if it doesn't feel good, don't do it. And I say that not to limit you, but really to actually help you push your boundaries. I want you to be active. I want you to start reaching for things, using your arms, moving around. But if you see that something doesn't feel quite right, just back off, give it a little bit of time. You'll be able to do it later. This will allow you to move more and keep things safe for your incisions, for your recovery. After that first week, you're kind of on cruise control where you're starting to move along, you're starting to become more active. And again, we are watching you very closely, most excitedly looking at your incisions and working with you to keep them beautiful and get that scar the best it can be. Usually after that first month, things are much more mobile. You feel much more normal, but you're still wearing your compression garment. You're still using the tapes. You're still getting the massages. Over that couple of months after surgery, that swelling will really start to go down. And often by 3 months after surgery, you're starting to really see what size and shape of an arm you're going to have. Most of my patients will get out of compression after about 3 months, but I really like them to use compression and continue with massage for as long as they possibly can. That's one of those things where I feel the more you do, the better your result will be. And then finally, in the long term, we start getting down into the nuanced stuff of your swelling, of the massages, but we are working on that scar nonstop. So, traditionally, the scar for an arm lift was just frankly not good. Traditionally, the arm lift was something that had a very high complication rate. But with my more modern and more precise techniques, we're doing things where our scars are beautiful and minimal. They will always be there, but they will be barely visible, and your recovery is great. So we'll use different kinds of surgical tapes, special mesh tapes, silicone sheets, silicone gels, a ton of stuff. And then as you need, if there are specific areas where we need to inject with different medications, give laser therapy, microneedling therapy, Morpheus, whatever you need, we will address the specific needs of your scar. Not for 1 month, not for 6 months, not for a year, but at least 2 years after surgery, your scar will continue to evolve and change, and we are going to work with you every single step of the way so that you get an arm lift that will have a contour that is tight, beautiful, and in line with the rest of your body, and you are going to have a scar that you're going to be proud of and excited to share with the world. So this is a beautiful process that will give a beautiful result. It takes a lot of work, and listen, you did a lot of work to get you to the place of needing an arm lift, and we're going to work with you to take you across that finish line and give you something that you will be excited to share and proud of. Hope that helped. If you enjoyed this video and want to see more about plastic surgery, definitely follow me, subscribe to my channel. I can't wait to share with you what we have.